Yeah, so I'm going to present a paper that we call Parental Time Investments and the Adult Outcomes of Children. And it's joint work with Mette Gertz, who is at University of Copenhagen, and Almudena Sevilla, who is at University College London. And I'm at both places, currently now in Copenhagen. Okay, and yeah, and if you have any clarifying questions, I don't mind if you just interrupt me and ask them during my presentation. So we know that there is a large intergenerational correlation in many socioeconomic variables such as income, wealth, education, and also divorce. There's also in the literature a broad consensus on the critical role of early life inputs in promoting children's long-run socioeconomic outcomes. As such, the literature on how to foster child development is an active area in many research disciplines. In my discipline, which is economics, time and money has always been considered two important inputs in the production of children's skills and children's development ever since Gary S. Becker's seminal work in the 60s. However, in part because of the difficulties of getting time use data or data on time investments and linking it to child development outcomes, the literature has devoted most attention to how income affects child development, and less attention has been paid to how time investments may affect children's outcome. There is a small and a growing literature on how time investments affect children's outcome, but it's mostly focused on short-run outcomes, measuring cognitive and non-cognitive development through test scores or even parent-reported behavioral outcomes, which may not be the best predictors of how children fare throughout their life, and especially not a good measure of inequality in adulthood. I mistakenly wrote parenthood here on my slide, but when children are grown up. However, one important point that has been established during this ongoing literature is that time is not just time. The papers that investigate the quantity of parents' time with their children and children's outcome find mixed results, even some negative results between time investments and children's outcome, which is primarily driven by time spent in unstructured activities, which could be television watching, for example. On the other hand, the literature has also concluded that there is some time that seems to be productive for children's development, and this is often referred to as structured time or even educational time, such as reading for your children. There is also this hypothesis that have been shown in some papers that certain activities are more beneficial for children of certain age groups. For example, basic care may be more beneficial for younger children, whereas management activities are more beneficial for older children. So what we do in our paper and how we think we contribute to this literature is that we link these time use diaries we have from Denmark and link it to administrative register data, allowing us to follow children over a long time period without having any attrition. So we are able to measure how children's education and earnings outcomes are when they are 30 years old, which is real life outcome that are relevant in a quality discussion, and not just simple cognitive and non-cognitive test scores. So just to give you a picture of how Denmark looked in the 1980s, where we have this time use data from. So many of you probably have heard about the Scandinavian countries and know that some things are a bit different here, and that was also the case in 1987, where we collect this time use data. So Denmark is a country of free healthcare. There's free schools, and there's also free university education. Even in the 80s, there was a quite high enrollment rate in publicly provided childcare. It's not free though. Parents do pay a small amount, relatively small, around 10% of the income maybe. And as such, there was around 70% of children in the preschool age and 40% of children attending nurseries already in the 80s. Women were quite active in the labor force, so 78% of women had a job in the 80s, and a bit higher for men. However, the time that children spent with their parents, or parents spent reading and playing and teaching their children, is not that different in Denmark compared to other OECD countries. So Denmark is this one in the middle. I'm not sure whether you can see me pointing, but yeah. So the amount of time that parents devote to their children in these potential beneficial activities does not seem to be an outlier. So I already briefly mentioned that we use data from Denmark. So the administrative data is actually data on the entire Danish population with personal identifiers and family links, so we can link parents to all their children, and we know who is the sibling of who. And we collect information on outcomes in the registers as well. So we have high school records reported directly from the high schools to the Statistics Denmark, and we also know there how many years of education each individual has received, and we also know from tax records the amount of earnings each individual have at each year. We collect them at age 30. Further, we can also use the registers to collect a number of characteristics on all individuals. For example, we collect information on the gender of the child, the year of birth of each child. Then we construct a measure for birth order within each family, and also the spacing to the next sibling. We collect information on birth weight to use as a measure of endowments. We also have gender of the parent who filled out the time use survey, and the parent's education, and their labor force participation, which we then divide into no participation, part-time or full-time participation. So the time use data we use is collected in 87. It was a random sample of the Danish population between 16 and 74. However, because we want to look at parents, we select individuals with at least 2 children between the age of 1 and 14 living in the household, giving us a sample of just above 1,000 children. And yeah, so the parents filled out these surveys while also indicating who was present during each activities, and they could choose between 39 activities, and they reported the time activities for intervals of 15 minutes. And the important thing is that they were asked who was present during each activity, specifically whether the youngest, the second youngest, or the third youngest child was present during each activity. That allows us to look at sibling-specific time use with parents. Yeah, so all time is measured in minutes per day, and we follow the literature and try to group these types of activities into 5 different activity types to avoid having a lot of centered data. So we construct a measure for basic care activities, one for structured activities, including studying, reading, doing hobbies and education. We also have unstructured activities, which is when a child is present doing housework or watching television, which is probably the most frequent activity in this category. And then we have management activities and also just socializing activities. Yeah, so this is just a table of some descriptive statistics showing the amount of time spent in each of these different categories, and separately for families where the youngest child was before school starting age and where the youngest child had started school. And we see that parents on average spend around 330 minutes with their children. It's only about an hour doing basic care. Unstructured care is certainly a lot higher, and so is socializing care. We also see that basic care is more frequently done with in families with younger children than older children, which is not surprising and certainly also in line with what the literature has found. So we use 2 different strategies in our paper to look at how this different types of parental time investments affect long-run child outcomes. First, we start with a simple OLS model controlling for a lot of child and parental characteristics that I mentioned before. And then we move on to a sibling fixed effect model, which has the advantage that it can net out all constant observed and unobserved characteristics shared within each family. Yeah, and in the fixed effect model, we also include all our child-specific characteristics, which is the dummies for birth order, spacing to the next sibling, the gender of each child, and a dummy for whether the child was born with a low birth weight below 1,500 grams, and or is it? Yeah, I think it's 1,500. And then also dummies for the child's age. We cluster the standard error at the family level, and because we look at a lot of different outcomes and a lot of different time investments, we adjust all our p-values to q-values using a multiple hypothesis testing developed by Anderson in 2008. So this is a table of our OLS results. What I want you to notice here is the lack of stars and also the quite large amount of zeros, meaning that not only are all the estimates insignificant or not statistically different from 0, they are also quite close to 0 in terms of magnitude. And the same is true when we instead look at the fixed effect, the sibling fixed effect model. And just to put the estimates into some meaningful measure, I can say that if we increase the total time that parents spend with their children by 10%, which would be about half an hour, that would increase high school graduation by only 0.4 percentage point, or educational attainment by 0.006 years, which is equivalent to 2 days. So you had to, or instead, if we wanted to increase educational attainment by a month, parents would have to spend 470 minutes per day extra with their time, which is substantially more than the mean. Not only are all the estimates insignificant, they are also economically small. Of course, you might want to consider that fixed effects estimates may still have a negative bias and thereby mask a true positive effect if parents are trying to compensate lower endowed children by spending more time, more beneficial time with them. However, we find no evidence that children of born with a low birth weight receive more time than their siblings, and if they do, it's time spent in unstructured and socializing activities such as watching television, and it is doubtful whether that would have any positive effect on child outcomes. So we also look at a lot of heterogeneity in the paper, for example, whether the youngest child in the family was below age 5, across different parental education and gender of the parents. What we do is just to include interaction term between each of these variables and our time variable to have a certain number of observations in our estimations. The picture doesn't change much, and all the estimates are still both statistically and economically insignificant. We do find some evidence that basic care provided by the mother may be more beneficial, and also that time with higher educated parents may be more beneficial for child outcomes. So to conclude, this is probably the first paper to link parental time investments during childhood with long-run adult outcomes. We find that parental investments during childhood are largely unrelated to long-run outcomes, indicating that parental time investments are not the key to reduce inequality in adulthood. However, it's likely that the effect of parental time investments may wear off over time, and that's why we don't find any effect, at least in a country with a large social security net, high enrollment in public childcare, and also free education. Thank you for listening. Happy to take any questions.
Thank you very much, Sarah. I mean, when people digest all the information what we have got, I would like to make a couple of remarks on your contribution. I think it's exceptional, especially what your case shows, of a European country such as Denmark, who is able to have all this information about these citizens, and you have been able to link it to time use diaries, and you have been able to link it to the specific persons and to know how the achievements in their lives are. No, this is something I think for the moment for Spain is something not possible to imagine that we could even get to close to that. No, I think one of the arguments we often have also with the Spanish authorities, especially regarding education, is that we have too scarce access to data. Data is poorly collected, there is little data, and the data what is collected is usually not available for researchers. And I think this is something that we should learn also from the model of Denmark. No? That the data allow us to test hypotheses that help us to improve society. And I think your paper is a very clear example of that. In the other hand, your paper also shows that the Danish society, at least for what I understand, Danish society is able to provide institutions, especially education and also other caring services, which are able to make that the private part, what the family adds to that, is important, but is not determinant for the well-being of individuals. And I think it's also a good example of how social strategies, and this, of course, the Nordic model is always an example for us in the south of Europe. The common solutions provide a better future for all citizens, rather than individualistic approach. No? Like we have in Spain, for example, one of the highest rates of inequality in schools and also private education, private institutions for education, which are mining this idea of the equal opportunity. No? That I think your model and your article what confirms is exactly this. If you create a good society and you create good institutions and provide a good service, equal, free for all, even if the early childhood is no, has to be paid a little part from the parents, the rest of education is free, and health is free also, like we have done also in our region recently, but it was not some years ago, for example. Then you get all these effects. No, you get that individuals are able to make it regardless of what is the family background. And of course, you have also less inequality in your society, which makes things also easier. No? But I think altogether, your article, what is a very good example of how this Nordic model is outperforming other models, no, especially more liberal models. You wanted to say something, Sarah? Sorry.
No, I agree very much with your view on this, and yeah, thank you for elaborating a bit on the perspective and also the situation in Spain. Thank you.
Thank you very much. So, is there any question from the audience? Please, Joan, go ahead.
Yes, thank you very much, Sarah, for the presentation. I will also add a comment in the line of what Daniel said about the data, the quality of the data that you have presented, and the data that you are able to do your research. Because here in Spain, it's really difficult to get good data to do research. Sometimes you want to do some study, and then you are very limited what your data is. So being data with registers, with surveys, but also, for example, for the time you surveys, we are still limited by the information that is from 2010, the last survey we have. So just to make a general comment about this, you know, that the difficulties we have sometimes to do our research because of the data limitations, you know. It's good to see what happened in other countries, that maybe there are some legislation issues and whatever, but try to because sometimes it's very difficult to do the research without good data. But it's nice to see that in other places you can do that. Thank you very much.
Yeah, well, I must be grateful to live in a country like Denmark with the research infrastructure, certainly. And yeah, but it's also a product of having a big public sector. So these are all done from central. It's not only me that collected the data, and it's only possible because we have Statistics Denmark as a huge institution collecting all this data. But yeah, it's of course something to be grateful for as a researcher. Yeah.